Hello, everybody, and welcome to Perspectives. We're glad to have you with us, even if we do go backwards sometimes. We're going to be talking about Medicare today, and I know you have questions, I have questions, and we have with us Wendi Schoonover, who's going to try to answer all of those questions and bring us up to speed. Welcome.
Well, thank you. Thank you for having me. I'm happy to be here.
Yeah, I want to ask you right off the top.
Yes, sir.
Is it normal or is it legit if I get a phone call from somebody claiming to be with Medicare?
No. Typically, the only time Medicare is going to communicate with you, it'll be through the mail. And the only time they would reciprocate contact is if you initiated it. So if you call in and maybe asked for a call back, but they're not going to call you unsolicitedly.
What then is the difference between Medicare and Medicaid?
Oh, heavens. So Medicare is a federally funded program that is for anyone who is an American citizen who pays into through working 40 quarters and pays in by taxes, just the same way we qualify for Social Security. It's for anybody who turns 65, certain people who are under 65 with end-stage renal disease and ALS. Or people who are granted Social Security disability after a 24-month waiting period will automatically be eligible for Medicare. That's the program that has different letter parts to it. So Medicare Parts A, B, D, and sometimes C, depending upon your preferences, which we may get into later. Medicaid is also partially federally funded, but it's specific by state. So that's for people who maybe are living at or beneath the poverty level regardless of age, and they need a little extra help to have some type of health coverage. Mm-hmm. Does that make sense? I know that gets confusing.
I've always wondered what the outstanding difference would be, and quite clearly you've answered that without me getting into it.
Great.
Well, that concludes it.
All right, thanks.
No, I sit down.
Appreciate your time.
Medicare is open to anyone, is it not?
Medicare, it is generally speaking correct. If a person doesn't pay in their 40 quarters and through paying into the system through either themselves working or their spouse working, they would not necessarily qualify for Medicare. You have to be an American citizen, and if you're not, you have to, or if you're a new citizen, I guess I should say, you have to have contributed at least that long and had lived in the United States for the preceding 5 years, I believe the rule states. But
it is not a charitable organization.
Absolutely not, no sir. Medicare is actually pretty incredible. I mean, the idea of it, right?
Concept is beautiful.
It really is. The problem we have in the U.S. is that it only covers 80% of your healthcare costs. The 20% gap is unlimited. So insurance companies developed Medigap plans, otherwise known as Medicare supplement plans, and later developed Medicare Advantage plans. And the spirit of both of those is to put a limit on the 20% gap in Medicare. In other countries, the 20% gap is not unlimited, or if there is a gap, it is not unlimited.
Well, let's jump on that for just a minute.
Sure.
We've got a little time before we have to run on out of here. How does one grab supplemental insurance to go with and work with their Medicare policy?
Well, that actually is where a company like mine or another like it or an individual agent would come in. So what I do is when somebody's either turning 65 or maybe been on a plan for some time and just wants to compare what's out there, we broker with the companies who issue those plans. And so we put together side-by-side comparisons for people based on their own set of, doctors, specialists, medications they're on, and their preferences, right? And evaluate which of those plan types is going to be the best fit, and under that umbrella, which company is going to be the most advantageous for that individual. So usually you can, work with somebody that you trust to help you find those for you.
Well, it always makes me feel like I'm about that tall.
Sure.
When I'm on cable TV watching, you know, and up pops this
Joe
phone
Namath
bank
or
of
whatever.
people
Yeah.
with every question you possibly could have.
Right.
And they're all set to answer it.
I know. Well, and I think, at least for me, when I'm looking to work with somebody professionally, I also want to consider, do I feel like they have some humility? Because I don't want to ever assume that I know everything, which is the reason that I have other colleagues and associates that I work with. We have a team of people to help answer questions that might be outside of our scope. So, and the other thing too is, because we live in a world where if you've got enough money, you can pay somebody like Joe Namath, right, to come on television and say, you know, and that's hard to not trust.
Yeah.
You know, he's a guy that guaranteed a Super Bowl under unrealistic circumstances and then won it with a kind of a terrible team. So you get a guy like that and you pay him enough money.
Excuse me.
Yeah.
It wasn't kind of terrible.
They were terrible.
Bums. They were bums.
Right, yeah.
I'm sorry. Go ahead.
No, that's good. That's okay. But, you know, he's like, I guarantee it. And then they win. Yeah. Well, hey, you know, that generation, your generation witnessed to that. So you have this reputable person saying, call this phone number. Those phone numbers that you're seeing are typically Medicare Advantage plans. And I don't have any hiccup about an Advantage plan, but they're not the best fit for everyone, right? So you get excited about these promises that are made and call those toll-free numbers and talk to somebody that sounds like they know what they're talking about, and you may not necessarily be matched with the plan type that you even wanted in the first place, and then how do you get out of it?
Feet to the fire question.
Okay, here we go.
How does one who suddenly realizes they're facing it, how do they know who to call?
Well, I would say, to be totally objective, the first phone call I would make if I found myself in that and I just really didn't know, I would probably call Medicare directly. That'd be my first, phone call. Because
they don't call you.
Because they're not going to call you. They're in a completely objective position and they are making $0 off of any plan switch that they're making for you. The next best thing is if you know somebody who works in the field that doesn't charge a fee to just help answer questions like we do, or if you know of a friend or a family member who works with somebody that they could refer you to help get you out of that situation.
You know what? I feel like I owe you a debt of gratitude for taking time to come in. These are questions that I hear all the time.
I bet.
Of course, I'm in that happy little age group. And I know what I speak.
Right. I understand. I appreciate the opportunity. It's hard as a small business owner, you know, to have exposure. So it gives me an opportunity to have that. But I also genuinely want to be a source of, just a source of answering those questions for people, you know, because it is hard when you're in a vulnerable demographic, and a lot of the people I deal with are single people, you know, or widows or widowers who may not even have family around to ask, and even so, their family might not know, you know. So my parents are in that demographic, you know what I mean? And I have a soft spot for that. So I want to be a person who people feel comfortable reaching out to help answer those questions. So anytime.
Thank you for coming in.
Yes, sir. Thank you for having me.
For answering so many questions that need to be answered. And we can't always get the straight poop on things
I know.
we need,
I know it.
unless we have a dog.
Right.
Anyway,
But then you have to scoop it.
Thank you again for coming in.
Thanks for having me, Sam.
Very
I really
grateful.
appreciate it. This is fun. Thank you very much.
We're going to take a short break. We'll be back with more right after this.